And now your host, Dr. James Haney.
Thank you and welcome to the show this morning. The topic this morning is managed health care, and we're fortunate to have with us Mr. Bill Bailey, who is the Senior Account Executive for the Metropolitan Life Insurance Companies. And Mr. Bailey, let me welcome you to the show this morning.
Thank you very much, Dr. Haney.
You know, Mr. Bailey, I think we've had you on with us talking about Metropolitan Life and managed care and some of the other things that are significant in insurance and in health. But let's, for those members of our audience who did not have an opportunity to hear you or to see you that day, let's talk about your background and information that was important in terms of you becoming the Senior Account Executive for the Metropolitan Life Insurance Companies, and not only talk about that, but also the Metropolitan Life Insurance Companies as well.
I'd be glad to do that, although it's hard for me to conceive that there would be anybody out there in your vast audience that didn't see that program that aired several months ago. But I did start with Metropolitan Life Insurance Company back in 1966. Back then, Metropolitan was just breaking away from the debit system that the company really became famous for, and started a new breed of agents that they called insurance consultants. And I was fortunate enough to be hired during a period of time when they were hiring this group of individuals who were to go out into the field without any rate books to say or without any debit books to say, and to bring in new and larger size clients into the insurance business. And that worked well for a number of years, and then finally we got back to a very generic name of calling us insurance salesmen, which is really more befitting to what we actually do in our business.
Now you finished at Tennessee State University.
Oh yes, I'm a very proud.
Let's talk about that
Well, I'm a very proud graduate in 1956 from Tennessee State University. I kind of bounced around. I changed majors about 4 times while in school at Tennessee State, and ultimately wound up with a major in biology and with a minor in sociology. Really didn't know exactly what I wanted to do when I got out of school, and Uncle Sam decided that he had a job for me, and so I spent a couple of years in the military, then got out of service and worked for a while, and ultimately wound up teaching school over at Wharton Elementary School, and taught there for 6.5 years before coming into the life insurance business.
And so in a real sense, you're not only not only have been involved in insurance, but also in education.
Yes, yes. And I enjoyed the period of time that I spent in education. And my ultimate goal was to probably at this time in my life, I'd be considering retiring as one of the top level administrators at the Board of Education, but it just didn't work out that way for me.
Very good. You know, in looking at some of the issues that are involved in health care in America today, you're a person who has had certainly your ear to the ground dealing with the issues that are important to the American people. Let's talk about some of those health care issues today from your perspective, and sort of give our audience what you consider to be the most significant issues that we are now debating.
All right. I think some of the most dramatic and far-ranging changes are coming about in the health insurance industry right now that have ever happened before. Of course, one of the products that my company sells is individual health insurance, and we also are the leading company in providing group health insurance policies to major companies in the United States today. So obviously our company is quite concerned with changes that are on the horizon and some that are in the process of being made. By and large, I think that these changes are at least attempting to be done for the betterment of the insured public out there, although really the non-insured public, because much of the health care today is being geared toward those hundreds of thousands of people out there who have no insurance at all at this time. And that's what the president's whole concern is right now. The Clinton health plan is to try and provide an adequate health care plan for everyone. There are many people who have it. You have it, I have it. There are large numbers of people who do have it, but by and large there are still large numbers of people who have absolutely no type of health care at all. So the effort that's being made is to make sure that adequate health care could be provided to each and every person. And to this end, I applaud that effort.
And looking at those issues, those as important issues, now what does that mean to Metropolitan Life and other insurance companies?
It means some very significant, far-reaching things to us. It could mean, depending upon the type of plan that is finally approved, and I think there's a lot of misinformation out there right now. There are a lot of people that think that we already have a plan. That's not the case.
Well, let's clear up some of that misinformation. As a matter of fact, if you think in terms of the things that people really don't understand about this national debate in reference to health or insurance, let's talk about those as issues this morning, because I think that those are the most significant.
Sure. What the president did some long time ago, and I guess Hillary Clinton was also one of the proponents of this, was to form a commission which comprised several individuals, some in the insurance business, some in business, some general lay people, to come together with a plan which took an enormous amount of time and tremendous volumes of paperwork to come up with something that they could say to the president, this is a plan that we'd like to go with. A lot of people think that a plan has already been enacted. The only thing that has happened right now is a proposal has been presented, and it's probably on the president's desk at some point. And I think right now it's to be at least looked at again sometime in September. But neither the House or the Senate, either one, have acted on any kind of plan right now. And I think what happened was the governor of our state realized what was coming about and was able to get legislated the TennCare plan, which is a plan that kind of correlates with this role model plan that's on the president's desk right now, and I'm sure the president enthusiastically endorsed that because it gives an opportunity for the plan to have some degree of track record. So I think in the state of Tennessee, we're kind of pioneers in the area because we do have a plan that's operational, and although it had some problems in its inception, the plan seems to be up and going and seems to be doing fairly well.
Now, out of these various plans, there has emerged within the healthcare industry things that certainly have been going on for quite a while, but I think that now they're making the headlines. We talk about managed care and the significance of managed care. Now, tell our audience this morning exactly what do we mean when we talk about managed care, and how significant is managed care within the framework of the entire health insurance or health care industry?
Sure. What managed care attempts to do is to have everybody who is a provider of health care on the same page, talking about the same kind of thing at the same time. One of the big problems in the insurance industry is that we all have terms that are generic to us as companies. My company will have certain terminologies and policies, and they'll be located in certain places within the policy. Another company will have certain terms and terminologies and expressions that are in that policy in different places, to such an extent that it makes it very difficult for a layman to understand anything about comparing insurance policies, because you don't understand the one you have, nor do you understand the one you're comparing with. So under managed care, we've been a set of circumstances or a set of rules have been given that each of the players that plan to participate in this ball game, so to speak, this healthcare ball game, are operating under the same rules and regulations and requirements, which in the long run should make it easier for the insured public to understand what's being provided to them. So that's what we mean when we say managed health care. It means you've got a set of rules and regulations and a set of benefits that are going to be provided equally to each and every individual within the United States, or within the purveyance of the plan that's being provided.
Is what we are doing in terms